Pharmacy is the science and practice of preparing, dispensing, and reviewing drugs and providing pharmaceutical care to patients. Here are some basics of pharmacy drug classification. Drugs are classified based on their chemical and therapeutic properties. They are classified into different categories like antibiotics, antacids, analgesics, and more. Pharmacy education. To become a pharmacist, you need to complete a degree in pharmacy. In some countries, you can also become a pharmacist through a diploma or a certification program. Prescription filling pharmacists are responsible for dispensing medications to patients with a prescription from a doctor. They ensure that the prescription is accurate and safe for the patient. Drug interactions pharmacists also have the knowledge and expertise to identify potential drug interactions between different medications a patient may be taking. They can advise patients on how to avoid harmful interactions. Compounding. Some medications may need to be compounded or prepared specifically for a patient. Pharmacists can prepare these medications based on a prescription. Pharmaceutical care pharmacists are also responsible for providing pharmaceutical care to patients. This includes counseling patients on the proper use of medications, monitoring for side effects, and advising on lifestyle changes to improve health outcomes. Regulatory bodies. Pharmacy is a highly regulated profession, with many regulatory bodies overseeing the practice. These bodies ensure that pharmacists adhere to high standards of ethics, professionalism, and patient care. Drugs are classified based on their chemical and therapeutic properties. Here are some common drug classifications. Analgesics. These are drugs used for pain relief. Examples include aspirin, ibuprofen, and acetaminophen. Antibiotics. These are drugs used to treat bacterial infections. Examples include penicillin, amoxicillin, and ciprofloxacin. Antidepressants. These are drugs used to treat depression and anxiety. Examples include selective serotonin uptake inhibitors SSRIs such as fluoxetine and sertraline. Antihypertensives. These are drugs used to lower high blood pressure. Examples include ACE inhibitors, beta blockers, and calcium channel blockers. Antipsychotics. These are drugs used to treat schizophrenia and other mental health disorders. Examples include haloperidol and risperidone. Diuretics. These are drugs used to increase the production of urine and reduce fluid buildup in the body. Examples include furosemide and hydrochlorothiazide. Hormones. These are drugs that regulate bodily functions. Examples include insulin, thyroid hormone, and estrogen. Immunomodulators. These are drugs used to regulate or suppress the immune system. Examples include corticosteroids and immunosuppressants. Sedative or hypnotics. These are drugs used to induce sleep or relaxation. Examples include benzodiazepines such as diazepam and lorazepam. Stimulants. These are drugs used to increase alertness and energy. Examples include caffeine, amphetamines, and methylphenidate. It's important to note that some drugs may fall under multiple classifications depending on their chemical and therapeutic properties. Additionally, some drugs may have different effects on different people, so it's important to consult with a healthcare professional before taking any medication. Pharmacists are highly trained professionals who are responsible for dispensing medication and providing pharmaceutical care to patients. Here are some basics of pharmacist education. Educational requirements. In most countries, pharmacists are required to have a degree in pharmacy. This degree typically takes 4 or 5 years to complete and includes courses in pharmacology, chemistry, therapeutics, pharmacy law, and pharmacy practice. Licensing. After completing a pharmacy degree, pharmacists must pass a licensing exam to practice pharmacy. The licensing requirements may vary by country or state. Continuing education. Pharmacists are required to complete continuing education courses to maintain their license and stay up to date with the latest developments in pharmacy practice. These courses may cover topics such as new medications, drug interactions, and patient counseling. Specializations. Some pharmacists may choose to specialize in a particular area of pharmacy, such as oncology, pediatrics, or geriatrics. To become a specialist, additional training and certification may be required. Professional organizations. Pharmacists may also join professional organizations to network with other pharmacists, stay informed about changes in the field, and advocate for the profession. Examples of such organizations include the American Pharmacists Association (APA) and the International Pharmaceutical Federation (FIP). Ethics and professionalism. Pharmacists are held to high standards of ethics and professionalism. They must maintain patient confidentiality, avoid conflicts of interest, and always act in the best interest of their patients. Overall, pharmacist education is rigorous and requires a deep understanding of medication and patient care. Pharmacists play a critical role in the healthcare system and are essential in ensuring that patients receive safe and effective medication therapy. Prescription filling is a crucial responsibility of pharmacists. Here are some basics of prescription filling. Receive prescription. Pharmacist receive prescriptions from patients or healthcare providers. Verify prescription. Pharmacist verify the prescription for accuracy and ensure that it is safe for the patient to take. They check for potential drug interactions, allergies, and dosage accuracy. Prepare medication. Pharmacist prepare the medication according to the prescription. They may need to compound the medication if it is not commercially available in the prescribed form. Label medication. Pharmacists label the medication with important information such as the patient's name, dosage, and instructions for use. Dispense medication. Pharmacists dispense the medication to the patient or their representative. They may provide counseling on how to take the medication, potential side effects, and any precautions or warnings. Document filling. Pharmacists document the filling of the prescription, including the date, the patient's name, the medication dispensed, and any counseling provided. Follow-up. Pharmacists may follow up with the patient to ensure that they are taking the medication correctly and to monitor for any side effects or complications. It's important for pharmacists to be diligent in their prescription filling responsibilities to ensure that patients receive safe and effective medication therapy. They also play a critical role in preventing medication errors and promoting patient safety. Drug interactions occur when two or more medications react with each other in a way that affects the safety or effectiveness of the medication. Here are some basics of drug interactions. Types of drug interactions. There are three main types of drug interactions: pharmacokinetic, pharmacodynamic, and pharmaceutical. Pharmacokinetic interactions. These interactions occur when medications affect the way the body absorbs, distributes, metabolizes, or eliminates other medications. For example, one medication may increase or decrease the metabolism of another medication, leading to changes in its effectiveness or side effects. Pharmacodynamic interactions. These interactions occur when medications affect the way other medications work in the body. For example, one medication may increase or decrease the effects of another medication by affecting its target receptors. Pharmaceutical interactions. These interactions occur when medications interact physically with each other. For example, two medications may not be compatible when mixed together in a solution. Prevention of drug interactions. Pharmacists play a critical role in identifying and preventing drug interactions. They review medication lists and medical histories to identify potential interactions and can advise patients on how to avoid harmful interactions. Management of drug interactions. If a drug interaction is identified, pharmacists may need to adjust medication doses, change medications, or monitor patients closely for potential side effects. Importance of communication. Patients should communicate all medications they are taking, including prescription, over-the-counter, and herbal medications, to their healthcare providers to prevent drug interactions. It's important for healthcare providers and patients to be aware of potential drug interactions to ensure safe and effective medication therapy. Pharmacists are an important resource in identifying and preventing drug interactions and can help patients manage their medications safely. Medication compounding refers to the preparation of customized medications for individual patients. Here are some basics of medication compounding. Reasons for compounding. Medications may need to be compounded for various reasons, including if the medication is not commercially available in the required form, if the patient has difficulty swallowing pills, or if the patient requires a customized dosage. Compounding process. The compounding process involves combining one or more medications and/or ingredients to create a customized medication. The compounding process may include mixing, grinding, heating, and other techniques to create the final medication. Safety precautions. Compounding medications requires strict adherence to safety precautions to ensure the medication is safe for the patient. Compounding should be done in a sterile environment and with appropriate equipment and protective clothing. Quality control. Compounded medications should be tested for purity, potency, and sterility to ensure the medication is safe and effective for the patient. Compounding pharmacies. Compounded medications are often prepared by specialty pharmacies that have expertise in medication compounding. These pharmacies may also provide counseling and support to patients and healthcare providers. Legal and regulatory requirements. Medication compounding is subject to legal and regulatory requirements that vary by country and state. These requirements are in place to ensure the safety and effectiveness of compounded medications. Types of compounded medications. Compounded medications may include capsules, creams, gels, ointments, suppositories, and more. Overall, medication compounding is an important service provided by specialty pharmacists to meet the unique needs of individual patients. It requires strict adherence to safety precautions and quality control measures to ensure the safety and effectiveness of the compounded medication. Pharmaceutical care refers to the provision of patient-centered care that focuses on optimizing medication therapy outcomes. Here are some basics of pharmaceutical care. Patient assessment. Pharmaceutical care begins with a patient assessment that includes a review of the patient's medical history, medication use, allergies, and other factors that may impact medication therapy. Medication management. Pharmacists work with patients and healthcare providers to manage medication therapy. This may include adjusting medication doses, switching medications, or recommending changes to the patient's medication regimen. Patient education. Pharmacists provide patient education to help patients understand how to take their medications correctly, potential side effects, and how to manage any complications or adverse reactions. Monitoring and follow-up. Pharmacists monitor patients to ensure they are taking their medications correctly and to monitor for potential side effects or complications. They may also follow up with patients to ensure that medication therapy is achieving the desired outcomes. Collaborative practice. Pharmaceutical care is a collaborative practice that involves healthcare providers, patients, and pharmacists. Pharmacists work with other healthcare providers to ensure that patients receive the best possible care. Quality improvement. Pharmaceutical care focuses on continuous quality improvement to improve patient outcomes. Pharmacists may use data and feedback to identify areas for improvement and implement changes to improve medication therapy outcomes. Importance of communication. Communication is a critical component of pharmaceutical care. Pharmacists must communicate effectively with patients, healthcare providers, and other members of the healthcare team to ensure that patients receive optimal medication therapy. Overall, pharmaceutical care is a patient-centered approach to medication therapy that focuses on optimizing outcomes. Pharmacists play a critical role in pharmaceutical care, working collaboratively with patients and healthcare providers to provide the best possible care. Pharmacy is a highly regulated profession, with many regulatory bodies overseeing the practice. Here are some of the main pharmacy regulatory bodies. International Pharmaceutical Federation (FIP). The FIP is a global organization representing pharmacists and pharmaceutical scientists. Its mission is to promote the advancement of pharmacy practice and science worldwide. World Health Organization (WHO). The WHO is a specialized agency of the United Nations that is responsible for promoting health and preventing disease. It works with member states to develop and implement health policies, including policies related to pharmacy. American Pharmacists Association (APH). The APH is a professional organization representing pharmacists in the United States. Its mission is to advance the practice of pharmacy and improve patient care. European Medicines Agency (EMA). The EMA is a European Union agency responsible for evaluating and monitoring medicines for human and animal use. It works to ensure that medicines are safe, effective, and of high quality. Pharmacy and Poisons Board (PPB). The PPB is the regulatory body for pharmacists in Kenya. Its mission is to regulate the practice of pharmacy to ensure the provision of quality pharmaceutical services to the public. General Pharmaceutical Council (GPHC). The GPHC is the regulatory body for pharmacists in the United Kingdom. Its mission is to protect the public by setting standards for pharmacy education and practice and by ensuring that pharmacists meet these standards. Pharmacy Council of India (PCI). The PCI is the regulatory body for pharmacists in India. Its mission is to regulate the education and practice of pharmacy in India and to ensure that pharmacists provide safe and effective pharmaceutical care to the public. Overall, pharmacy regulatory bodies play a critical role in ensuring that pharmacists adhere to high standards of ethics, professionalism, and patient care. They work to protect the public and promote the advancement of pharmacy practice and science. In conclusion, pharmacy is a crucial component of the healthcare system that focuses on ensuring the safe and effective use of medications. Pharmacists play a critical role in dispensing medications, identifying and preventing drug interactions, providing patient education, and optimizing medication therapy outcomes. The pharmacy profession is highly regulated and requires rigorous education and training to ensure that pharmacists provide the highest quality of care to their patients. We hope this video has provided you with a basic understanding of pharmacy and its importance in healthcare. Thank you for watching.